Today's date is April 10th, 2014. We're here with Margaret. Margaret was referred in here by her mother, actually. Margaret has rather severe pain. I'm going to try and summarize a long history in a few sentences. A few years ago, she was underneath a cabinet, got up and smacked her head on the underside of a cabinet and damaged a disc in her cervical spine. It took about a year for that to heal with chiropractic and massage therapy, but she did heal. And then she had a couple more incidents. One was falling backwards into sand, striking her head, and she got a disc injury to her cervical spine. She also was involved in two rear ends. One was a very light rear end where the car was barely touched, but it triggered these older injuries. She went back into therapy, all manipulative and massage therapy, which really did help. But then she had a more serious motor vehicle accident last October. At 40 miles an hour, she was rear-ended. And I'm going to let her tell you the kind of agony she's been in since. Go ahead.
Hi, I'm Meg, and October 2013, I was rear-ended. The frustration and agony that I've been in is dealing with various doctors, chiropractic, massage, spinal doctors, and the final result was to get a cortisone shot. I've worked every day since this, and it's very emotional for me because I haven't gone a day since the accident without being in pain. I can't do the dishes. I can't cook a meal. I haven't grocery shopped in 4 months. I spend more time laying down, trying to give my back an opportunity to rest from the fatigue, whether it's 15 minutes or an hour. I drive for a living.
Keep talking.
Yeah.
She's crying. I want the viewer to see that.
I drive for a living, and there's times where I have an appointment an hour away from the house, and when I'm trying to get home, I'm 30 minutes from the house, and I almost stop to get a hotel room because I'm so fatigued I cannot make it home without being in pain. And I'm just grateful that there's other options out there for me, and I'm looking for some clear results here. Thank you.
Well, I'm hoping for them too. Thank you. I have your permission to video you and post you. Is that correct?
Absolutely.
On YouTube. Thank you very much. Now, this is for the viewer. I'm not always able to get a before photo shoot, so I'm really happy right now that we've got you before. I'd like to show the viewer the range of motion of your neck because this will be believable, okay?
Okay.
All right, turn your head to the right, please. That's not bad. Now turn your head to the left, please. I think anybody would say there's a significant problem there. Keeping your head in a vertical position, touch your ear to your shoulder, like that, and the other way. Okay, and now I'm going to ask you to bend your head forward as far as you can, and now bend it back as far as you can. That's very limited, wouldn't you say?
Yes.
All right, thank you very much. We haven't done your treatment yet, but I want the viewer to know that you have root canals and I checked for them, correct?
Yes.
And that was the first thing that I did with you.
Absolutely.
All right. And I didn't explain it to you, but teeth can interfere with other parts of the body. So that's why I did that.
Okay.
Also, I haven't promised you results, have I?
No. No.
Okay.
You've given me hope.
All right. I do promise that I do the very best that I can do.
Yes.
I promise that to everybody. Okay. You were telling me about what your doctor wants you to take?
My primary doctor has asked me to take muscle relaxers, pain pills, and then the latest was depression.
Something for depression.
Yeah.
Yeah.
And so, yeah, and it's been a couple weeks since they've given me that medication, and the bottles have been unopened.
All these bottles are unopened.
Absolutely.
This is really valuable for the viewer.
Yeah.
And I can't tell you how many patients I've seen, especially women, are given drugs for depression.
Yeah.
Which is a horror story for me because you're not depressed. Number one, you're in pain. And number two, these drugs can have catastrophic effects.
Correct. I was feeling hopeless, not depressed.
Treatment's over. You can please sit up. And you had what I would expect. You can sit. You had what I would expect. There was a little bit of stinging and pressure
Yeah.
for what, about 60 seconds?
Yeah, no more than 60, just like you promised.
Okay. All right. Let's see what you can do. I'm interested in seeing you turn your head to the right, please. As far as you can. Turn your head to the left as far as you can. Keep going.
That's it.
That's it.
Yep.
Okay. And now we're going to look this way. Just look straight ahead. Bend your head backwards as far as you can. All right. And bend it forward as far as you can. Oh, wow. I would say that's a very significant
feels
improvement,
better.
isn't it?
I don't recall, yeah.
Yep. You're touching your chin to your chest.
I didn't know what that was. It's been so long. Okay.
Okay. You want to get up and walk around? Tell me how your back feels, please. How does your low back around the T10 to 12 area feel at this moment? Be honest.
At the moment, I can just kind of tell that there's like a warming sensation in there maybe. But I don't, and I fatigue, a little fatigue, but
It's okay.
yeah.
You're looking at your results.
I am. I
And
am.
what was the first thing you did when you saw them? You put your arm around me?
I had to give you a big hug because I didn't expect instantaneous results like that I would have, just the motion.
You can see what happened. Tell
Yeah.
the viewer how much increase in flexion extension you got.
Well, in a couple areas, 20. In 2 different areas, 20, and 10 in another.
Well, flexion extension here started. Flexion extension started at 40 and 40. So that would have been 40 degrees of extension, 40 degrees of flexion, total of 80
Yeah.
flexion extension. Now you went to 60 and 50. So that's 115 degrees from 80 degrees. Your rotation, right rotation started at 70, it remained at 70. And your left rotation, which was your real problem, started at 40, and it went to 60.
Wow.
One session, and
Yeah.
that's only just after.
Yeah.
Okay.